So what state are you located in?
I'm in Massachusetts.
Oh, okay. Hmm,
Yeah, yeah.
okay.
All
All
right,
right.
Meng, I'm ready. So, let's just start with your background before you became a dental therapist. What did you
Okay.
do before?
Okay. Well, I've, before that I worked, in as a teacher's aide and educational educational aide to, in the Head Start program, with and also through the St. Paul Minneapolis public schools.
Hmm. Okay.
And besides that, I mean, I've had other jobs working as a pharmacy technician and then as a junior scientist at the University of Minnesota's Biotechnology Research Center.
Okay.
Um,
For those that don't know what a dental therapist is, can you just kind of start off with that? What is a dental therapist exactly?
well, a dental therapist is a licensed oral profession, professional who works as a part of a dental team under the supervision of a dentist who provides basic preventative and restorative care for the patients.
Hmm.
It's kind of like similar to a nurse practitioner or a physician's assistant in the medical fields.
Okay. So what made you choose dental therapy? How did you get into it or find out about it and that kind of thing?
Okay, well, I think what really got me into the profession is that I really developed the passion to want to work in underserved and low income communities and populations, and so that and that really stems from the fact that I'm working in the Head Start programs with low income families,
Hmm.
and working in the Minneapolis public schools where you work with a lot of kids and families who have you know uh, a lot of lack of general health care or knowledge or healthcare or healthcare, and so I really wanted to make a difference. So when the opportunity came, when I heard about the dental therapy program, I said that it really matched my passion and what I want to do with my career and my life, and so I went, applied into the program and got accepted,
Very good.
and that's where I am today.
And where did you go to school, Meg? Where's who offers the dental therapy program?
At the time, we were, the University of Minnesota was the first school to offer it, so I was the inaugural class at the University of Minnesota,
Mhm.
and yeah, so that's where I went to school.
And how long is the program?
The program is 28 months or 2.5 years, all year round,
Hmm.
and yeah, so
Hmm. And can you tell us like just a little bit about the admission process? What do you need to get in? A bachelor's degree, that kind of stuff. Like, what's
okay,
the
well,
requirements?
okay. There for the master's and bachelor's degree, it's pretty much you need the same requirements. Um, the difference is that it's I mean it's kind of different now. I mean, I'm kind of outdated exactly
Right.
what I'm sure they have changed the requirements of
Hmm.
actually needing to get into the school now. But from when I applied, um, we needed what is it? You just need your application process. Of course you write a letter, um, and then you interview with a few faculty members, and then I remember there's a reading and writing test as well
Hmm.
as a psychomotor skills test.
Hmm. Okay.
Yeah.
And did you take courses with hygiene students and dental students? You
Yeah.
guys do that?
Yeah, I was just looking over my um, courses of what I took, and yeah, roughly half and half were with the
Hmm.
hygiene students, and half of them were with the dental students.
Is that just the actual classroom, or do you guys do clinical with them too, or is that separate?
Yes,
Yeah.
it was a they wanted us to one of the focus of the school was to trying to get us to work in a team environment because
Right.
that's what we were going to do. I mean, once we get out into the real world, that's what
Yeah.
we will be working as a team. So
Yeah.
that's what they really emphasize that of us work trying to work together and
Hmm.
trying to work in that kind of system where we
Yeah.
can work together and feed try to work in that cooperation.
Right.
So
Right.
yep.
that would have helped in hygiene school. And we had dentists that were instructors in clinic, but we didn't have dental students with us. I think that would have been nice to have dental students with us, kind of
Yeah,
working together. Yeah.
yeah, I think that yeah, according I mean the way the University of Minnesota did it, I think it really allows us to see, and gain an understanding of what each other's studies were like, and
Mm-hmm.
we gain an appreciation and understanding of the skills that each profession
Hmm.
basically
Yeah.
has.
And as far as getting your license, is there? I know you guys have to do what, 2,000 hours or something like that after the
2,000
program.
hours is for the advanced dental therapy.
Yeah.
As far as getting the license, you of course you need to finish all your required courses from
Hmm.
a accredited dental therapy program.
Hmm.
Besides that, like the dental hygiene, you
Hmm.
need to take the jurisprudence. We had to sit for a credits exam that
Hmm.
included the mannequin and the patient portion of the
Okay.
test, similar to dental students.
Hmm.
And besides that, you have to be CPR certified,
Right.
like everyone
Yeah. So you
else.
guys had a clinical exam with a patient, like doing a restoration or something like that? Is what
Yes.
you did? Yeah.
Yeah.
Uh, let's see. And can you? I know there's a difference in the like you already mentioned the dental therapist and the advanced dental therapist. What is the basic difference between those two?
Um, besides, because it's such a new thing,
Yeah.
everything is not totally out on that yet. So
Yeah.
far, as far as I am and aware, there's only one advanced dental therapy therapist working in the state, and so I'm not full board. I don't have a good understanding of exactly what
Yeah.
that advanced dental therapist can actually do.
Hmm.
But the main difference is that there is the level of supervision. There,
Right.
as a advanced dental therapist, you have more freedom
Right.
and yeah.
Yeah. So in your
Very-
case, Meng, you're a dental therapist, not an advanced dental therapist. Is
Yes,
that
I
correct?
am just
Yeah.
dental therapist.
So you have to work with a dentist like in the building all the time, or do you do like the general supervision where they can not be there sometimes or
It,
something?
it It depends on the procedures. There's two categories of supervision.
Mhm.
There's general supervision. Where and then there's also direct supervision.
Right.
When you first start out, which I am currently, and I'm working under direct supervision of a dentist.
Oh, I think you're breaking up. Can you hear me? Right.
Yes.
Okay. All right. Can you say that again? I'm sorry, I was breaking up. I
Okay.
missed.
So
Yeah.
currently, I'm working as under the direct supervision of the dentist.
Okay.
And as you progress,
Mhm.
it's like, but with every dentist, you build a report with them,
Right.
and but eventually, I mean, as a advanced dental therapist, you just have more freedom,
Yeah.
and you work under more of a general supervision.
Hmm. I gotcha. Let me see. Do you know how many DTs are in the Minnesota at this point? I think I was reading like in January there was like 30 something. Is that
Yeah,
kind of
I
about what
think
it is?
yes, I think I'm approximately 29 or
Yeah.
so.
Yeah.
Yeah, in the state. Yeah,
Yeah. I'm sure it's going to grow over the years.
I sure hope so.
Yeah. Because I think I was reading something about there's a couple of thousand hygienists, a couple of thousand, whatever it is, dentists, So compared, it's very few. So
Yeah.
at this point, but
Hmm.
and I'm sure it's going to spread to the other states at some point. But
Yeah,
uh,
I heard Maine
yeah,
is in
Maine,
the
yeah.
process. Yep, accepting the dental therapist.
And then some other states that kind of doing and not doing, or starting the process.
Hmm.
So can you just talk a little bit, Meng, about what you can legally do, like cavity preps, extractions of primary teeth, that kind of stuff? Like
Yeah,
little.
sure. Yeah, yeah. I got the what is it? This is the Article 3 from the Board of Dentistry.
Mhm.
I just want to make sure that we kind of cover it because
Yeah.
to myself, it's hard to remember exactly everything that we can and can't do because I even though we are allowed to do a lot of these things, I don't do
Mhm.
all this stuff. So
Yeah.
yeah, like we could do under general supervision, we could do things such as oral health instructions and disease prevention,
Mm-hmm.
mechanical polishing, making radiographs, you
Mm-hmm.
know, pulp fertility testing, tooth implantation, local anesthetic administration, nitrous administration, and so on. Under a direct or indirect supervision, we need, like we can do stuff like cavity prep, placement and removal of space maintainers,
Mm-hmm.
placement of temporary crowns, extraction of primary teeth, and
Mm-hmm.
um, um, suture removals, cementing of permanent crowns. A lot of this stuff, if anyone who's interested can go to the board
Yeah.
and just look it up, because
Mm-hmm.
yeah, there's a lot of stuff. So
Yeah. And can dental therapists be employed in a private environment, or they have to? I think I was reading they have to have like see so many Medicaid patients or something like that, right? Something like
yes,
that. Yeah.
yes, there's certain percentage that we have to see.
Mm-hmm.
Yeah.
For the to qualify.
I
So
believe
they,
that. Yep, I believe that's like at least 50% of our patient
Mhm.
load has to be Medicaid.
Yeah.
Yeah.
And how did you find your current position? How did you find that?
Our dental director
Mm-hmm.
of my current clinic right now, he
Mm-hmm.
contacted the dental therapy program
Mm-hmm.
at the University of Minnesota, and through that,
Yeah.
I got this position.
Mm-hmm. And can you tell us what a typical day is for you and how things flow in your clinic? Like,
A typical day for me is, I go to work around 7:30, look at my patient load for the day.
mm-hmm.
And if I have any questions, I about a particular case, so I talk to the dentist, the supervising dentist
Mm-hmm.
that day. Um, and then, around 8 o'clock, I start seeing patients and kind of goes throughout the day. But in every case, I mean, every patient that I see, I always have a little time where I always have a chance because we work so close with the dentist that
Yeah.
I always have the opportunity to kind of ask the dentist
Mm-hmm.
if anything should come up.
And do the dentists do the kind of like hygiene, I guess? Like the dentist, is basically diagnosing,
Yes.
say for a hygienist, they're technically diagnosing the perio, and we're doing the treatment. Is that kind of how
Hmm.
it works with you?
Yeah, it does like that. It does work the same. If I can say, look, I see something here that looks suspicious or looks, out of the norm. What
Mm-hmm.
do you think it is?
Right.
It's a report you develop with the dentist,
Mm-hmm.
and the dentist, and then they can say, well, I will restore this, I will not restore this, and then
Right.
we do the treatment.
So the patients that are basically coming in for their, like say a new patient or a 6-month recall patient, they're getting their exam, I mean whatever gets diagnosed, and the dentist kind of maybe point towards, oh yeah, we'll give it to Meng. They can see Meng or that kind
Hmm.
of thing. Yeah,
Yes, yes, that's basically how it's broken down to. Yeah.
yeah, yeah. Interesting. Do you have your own dental assistant? Is that how you operate, or
Our
kind of?
Yeah, it's kind of like both. I
Yeah.
mean, I do have a dental assistant too, but then we have a dental assistant that kind of rotates. So it's kind of
Hmm.
both.
Yeah. Let's see. And how do patients kind of accept you? I know as a male hygienist, sometimes they assume I'm a doctor, and even when I correct them, they still keep calling me doctor. But I mean,
Yeah, you're right.
yeah.
I do get mistaken for a doctor sometimes too, but you're right. I have to say I'm just a dental therapist, and so far my experience has been pretty positive.
Mhm.
Most of the time you just have to show them that you're confident and
Mhm.
your work that you're confident in your work and your ability and your skills and
Mhm.
you in every situation you always trying to you gain their trust, and when you gain their trust, then they're
Mhm.
able to accept your work and what you can do for them.
Yeah. I know sometimes, with me as a male hygienist, it's very rare, but sometimes they want to see a female hygienist. I just like, oh, that's fine. I have no,
That's
I
fine.
have no, I have no problem with that.
Yeah, you're right.
Yeah.
It's fine.
Yeah.
It's the patient.
Hmm.
They always come first. So if any patient who doesn't feel comfortable, what we do at our clinic is that we have a little information sheet about me and what I
Yeah.
do,
Hmm.
and we put that in front of our admissions desk, and they have a chance to read that. And so for some people, they understand it, what it
Right.
is.
Yeah.
Other people, they still come in and ask questions, and that's your chance to kind of go over who you are and what you do.
Right. Right.
Yep.
Do you work in a like a community health center, Meng? Is that where you work?
Yes.
Yeah, that's what it
Yes.
is. Yeah.
Hmm.
Yeah. Let's see. All right. So, as far as your classmates, are they all working as dental therapists? Or, do you know? Or
As far as I know, yeah, most of them are
yeah.
working. I think there's only one, but she moved back to Florida. One of
No.
the latest I heard that she wants to move back.
Yeah. Yeah.
But most of my classmates are working as dental therapists.
Were most of your classmates already in the dental field, or are they kind of just out of other career fields? So were they like a lot of hygienists in your class, or is that kind of
I think
common?
there was a former dental hygienist, and then I think there was two that were dental assistants before.
Mhm. Yeah.
Yeah, but most of us have had either just have shadowing experience, or
Yeah.
have never had it, so any experiences.
Yeah. Interesting. So have you had cases where, let's say you're doing a cavity prep and maybe it's deeper than you thought it was going to be, or and you had to kind of, backtrack and maybe, I don't know what you would do, like put a temp filling in or have the dentist come in. Have you had cases like that, or not?
Well, I mean, if the cavity prep was deeper than I thought,
Yeah.
yeah, it's always a like I say, it's a report you develop with each
Hmm.
dentist.
Hmm.
Some dentists would say, if it gets go deeper, come and ask me. We'll
Right.
talk about it.
Hmm.
Other dentists is like, try to excavate it. If it goes to the pop, then it goes to the pop, and then
Right.
we'll deal with it at that time. So,
Yeah.
you know, you try your best to, of course,
Hmm.
not pop the tooth if you can,
Yeah.
but
And you
you know
and you can
that
extract.
happens. So.
Yeah. And you kind of mentioned like that you kind of gave a list of what you can do. You can extract primary teeth. Can you extract like permanent teeth that are like perio involved, that kind of stuff, or is it
No, no,
no,
no permanent teeth at all.
no permanent teeth at all?
You're
Okay.
just permanent teeth.
Yeah.
Yeah.
Because even dentists I know have a lot of trouble. Sometimes they have difficulty with like molars and stuff, so it's not an easy thing to do.
Yeah,
Yeah.
it's not
Yeah.
from what I heard. It's
Yeah.
not.
I went on a mission trip and I did extractions.
Oh,
It's
really?
tough. Yeah. I mean,
Okay.
yeah. I mean, when I went, I did like maybe 10, and there was some primary teeth that were pretty easy, but some permanent teeth, I didn't feel too comfortable doing it. They
Okay.
they they asked me to, because it's a pretty bad situation, but they asked me to do it, but I did a couple, but I had dentists there to
Okay.
kind of jump
Wow.
in for me if I needed.
Exciting.
Yeah. But I mean, at first I was like, I don't know about this. But I'm in the jungle right now, so.
Yeah. Awesome. Yeah.
All right, Meng. So, for those that might be interested in doing dental therapy, do you have any suggestions what they should do, or obviously you recommend doing it? Yeah.
Yeah, I would say I would definitely recommend, and anybody who's interested,
Hmm.
in working in underserved or low income populations, if you really have a passion for that, that's I think that is a key to
Yeah.
to have the longevity to work in their field.
Hmm.
And besides that, if you just want to if you want to help make a difference on a case by case, because dentistry is one of those fields very few fields that I know that you can make a difference in,
Yeah.
the
Absolutely.
day that the patient comes in, so
Yeah.
if you really enjoy that kind of, uh, thing, then I think I would really recommend it. And besides that, just if you enjoy working with your hands, because
Yeah.
it's you're constantly working with your
Yeah.
hands and interacting with patients. If you really enjoy that, I would
Yeah. I mean,
definitely recommend it.
yeah. I mean, for me, like as a hygienist, I saw it as I was interested in medical, in general, and
Okay.
it was working indoors and working with your hands, and using science and everything. To me, it was a nice combination of things.
Yeah, yeah,
Yeah.
yeah. Same
But
here.
yeah, exactly. All right, Meg. So I think I hit all the questions. I appreciate you doing this.
Yeah, no
I
problem.
think
And
I think a lot of people would be very interested because it is a kind of a new thing, and I think it's something that's going to probably spread, over time.
yeah, I
Yeah.
sure hope it does.
Yeah, and I think
And
I know there's a lot of, people. Some people don't like the idea, but I think it's going to be kind of like hygienists giving local or whatever. I think down the road they're going to see the advantage of having dental therapists, even if in a private sector,
hmm
job. I think just kind of delegating it to a mid-level. Basically,
hmm
what you do, same. To me, it's the same as a hygienist. You just delegating it to somebody that you're supervising. So
Sure.
I think it's a good thing. So,
I definitely hope so. Yeah,
yeah,
I hope it catches on, and
yeah,
more dentists are jump on board and see that
yeah.
it really can make a difference.
And it seems like people that are actually working with the dental therapists kind of have a positive attitude about it. So, yeah,
I think it has. Well, from
yeah,
the dentist that that I worked with, I think I really have
hmm
seen a difference. I mean, a lot of them come in very tentatively.
hmm
Not sure what this is, but for my experience, I think it's been really positive.
yeah,
They like the work I do. They have the confidence in me, and
hmm
I really enjoy that. So I
yeah.
mean, my experiences so far has been very positive.
Well, very good. All
Yeah.
right, Meng, thanks again.
Yeah.
Um,
Sure.
I'll have this posted in a couple of weeks, and I'll let you know about it.
Okay,
Like,
sure, sure.
as I,
And for anybody who's interested, they can look into the school of dentistry at the University of Minnesota,
yeah,
to get more information. I just cover a very,
yeah,
surface, level of what they might need. So if they
right.
need more specific details,
hmm
definitely contact the University of Minnesota. They have
hmm
good people over there that can really help them, or even contact the board of dentistry. If you
Yeah.
for the exact scope of what a
hmm
dental therapist or advanced dental therapist can do.
Yeah.
That's probably the
Yeah.
best resources for them.
And if you don't live in Minnesota, you can move there.
There you go.
I'm sure some people will probably do that or consider it.
Yeah.
But
Yeah, well, actually, we had a couple of people who are from out of state. My classmates were from out of states that
yeah,
came in. So that's an
yeah.
option.
I know a lot of hygienists wanna do that. It's a different path to take.
Yeah, sure.
And be something they would consider instead of waiting for their state to get it in 10 years or whatever it's going to be. When we go to
That's
Minnesota,
true. Yeah,
it's
it's
kind of cold.
definitely
Yeah, it's kind of cold in the winter.
definitely an option. Yeah.
All right, man. Thanks. Appreciate
All
it.
right. All
All
right.
right,
No problem, Mark.
have a
All
good
right.
night.
You too.
Bye.
Bye.